Your Excellency, and I'll say all protocols observed because of time. Your Excellency, I have worked with the persons living with disability forever. I had a company called Sharper Images that employed the deaf people, and I still have deaf people working in my office. And today I have been touched in such a special way. I feel that the money that was given to the people entrusted with this function was well spent. Well spent. As I walked around, you know, there are times you allocate money for a project and you go and you ask yourself, iyo pesa ilifanya kazi gani? But here, I have been, because I had spinal problems, I've been through physio at Aga Khan, at Nairobi Hospital, and I want to tell you that this facility has better equipment than all the private hospitals in Kenya. This facility has better equipment and coordination than all the facilities I've been even in India. And when I hear that they will be charging only 100 shillings for a child, and they're charging 1,000 for an adult, and I know that even Kenyatta National Hospital charges a lot more, I believe that we should publicize this facility and ensure that Kenyans get to know. Your Excellency, I heard you asking a question when you were being shown the facilities. You asked, na watoto wa Kakamega wataenda wapi? We had the 8 provinces. Such a facility should be replicated in all the 8 provinces. Your Excellency, all those women that you saw that are here with their children, you know, to be given a disabled child, it's a gift from God, we say, because it teaches you how to become so humble, and your humility and your love is challenged. So when you're given a disabled child, you are actually given a blessing, because if you can love that child, you are actually going to be a superhuman being. So I saw all those women, and one thing I know, even if they pay 100 here, if they're living so far away, it becomes very challenging. With our housing project, because of this facility being here, we should make a housing project nearby and strictly for women and mothers and parents who have disabled children. So the proximity is just within walking distance. So we should try and make a holistic approach to dealing with disability. And you know now, Your Excellency, first of all, I'm very touched today. And I want to congratulate everybody that put the money to good use. This is the kind of Kenya we want, where you're given a budget and you do the right thing. Now that I have your audience, and I know you're a very busy man, Your Excellency, we have a problem at Kenyatta National Hospital. They are detaining patients. There are a lot of patients being detained, beds being occupied by people who should go home. And us as politicians, we are actually crippling Kenyatta National Hospital, because over the last 10 years, they've probably written 10 billion shillings. And when they get a budget, they're not being given the 10 billion that they've written off. So they need to be replenished with their budget so that they can be able, because if you're given a budget for the year and you wrote off last year, because your patients couldn't pay, then obviously you're sinking in a big hole. So Kenyatta National Hospital is challenged. I don't want any of those patients to spend Christmas in the hospital. Some are detained for even 6 months, 1 year. I really pray that you will give a directive to release all those detained patients, because that is part of your UHC. The community health promoters that you recently...
For this person to be born